Good afternoon, everybody. We're doing this a little bit earlier today. Max told me many of you wanted to start planning your stay-at-home New Year's Eve parties a little bit earlier. So a few things we wanted to talk about here with Paul and Josh and Deirdre. Unfortunately, we don't have the COVID numbers at this early hour, but it's worth noting we do have the hospitalization numbers, and they're down 59 over the last 24 hours. I think that tells us that hospitalizations have been pretty flat for the last month. As of yesterday's numbers, our overall positivity rate is a tad below 6%, and we've been pretty stable for the last month or so there. And that's good news. As John Dunn says, we're not an island. No man is an island. And I look and I see New York is spiking up. Rhode Island is spiking up. Massachusetts is going up a little bit. And it's a very cautious couple of weeks we've got coming up. And urge you to do everything you can going forward for a little bit longer. And I know New Year's Eve is a time for great merriment. Unfortunately, the restaurants, bars aren't open, restaurants closing at 10 o'clock. Stay close to home. We're doing relatively well because we're keeping our guard up. Some people say because we're doing well, we don't have to keep our guard up. And I think that's the wrong message to learn from what's going on in Connecticut on the good front over the last few weeks. And on a hopeful basis, the vaccine update. There we do have current numbers. You can see almost 55,000 doses have been administered. That's good news in the sense that you've heard a lot about problems in other states around the country, problems in terms of delivery, problems in terms of long lines, problems in terms of getting people vaccinated. We have a higher percentage of our folks vaccinated than number one in the Northeast, doing very well nationally. I think Connecticut's pretty good. We've always, we've had some anti-vax protesters and some vaccine hesitancy, but overall, this is a state that has pretty good infrastructure when it comes to the flu vaccine. We're able to leverage off of that to good effect. Josh reminds me, when it comes to the nursing homes, a special shout-out to CVS and Walgreens. They've done extraordinary work in getting the vaccines out to both nurses and residents at the nursing homes. We're on track to complete everybody having their first vaccine in the nursing homes by the end of next week, which is what we wanted to do. Even more importantly, everybody in Phase 1A, which is hospitals, frontline healthcare providers, and the nursing homes, have their first and second vaccine over the course of the next month or so be done. So despite some of the national media, I think we're in pretty good track right now. And a special shout-out to our vaccination advisory board and, in particular, public health, who have been our folks there have been thinking about this long and hard, and it's making a difference. And we're going to have the Phase 1B guidance will be released next week, getting the final input from CDC so we can think about how we prioritize people starting in the end of January for the next group of first responders. This next chart is just a little reminisce. 120. What is 120? 120 is the number of these press briefings that you have suffered through, since the beginning of this pandemic. We did the first one in February. You probably don't remember, in the Emergency Operations Center. Then we decided we had to go virtual pretty soon. March 6th, we had the very first infection there at Danbury Hospital, there with John Murphy and Mark Boughton, and that was the wake-up call. And the group here today that are on with me, we just realized, first of all, it was on a daily basis we were doing these. Things were changing so fast. The infections were coming up. We had to do the best we could, find the best minds we could to advise us, and then explain every day what we were doing, why we were doing it, and why we thought it was going to make a difference. I can put in place lots of rules and edicts and penalties, but if you don't believe that these rules, starting with wearing the mask, starting with the social distancing, what we had to do with our restaurants and bars early on. If you don't believe it makes a difference, it's a lot tougher to enforce. And thanks to each and every one of you, we were able to get that done. We're able to enforce it, and it is making a difference. It made a difference back when we started reopening. And we had a lot of help as we were doing this, and this little eye chart is just an example of some of the 85 different people that joined us for our press briefings going back in time. And look, I said early on that I wanted to have a bigger table, and we've got Republicans and Democrats from the legislature been very active and involved, for which I'm much appreciative. We got our fair share of lawyers in that group, but also restaurateurs and others who run small business gave us guidance along the way. We also, as part of our reopening committee, we had labor and business and mayors at the table because they were really important in terms of what we had to do. And I am reminded as I look at this chart that over half the people related to hospitals, healthcare, and the scientific community. That's what we needed. That's who we had to lean upon over this last 120 briefings over the last 9 months of pandemic. Zeke Emanuel, Scott Gottlieb, a lot of the best minds we could find were there at that table. Dr. Tony Fauci, one of the first things he did publicly was to reinforce what we're doing here in Connecticut, for which I was so appreciative. Let me just give you a short shout out to a few of the folks who have been here from the very beginning. Dr. Albert Coe and Ingenuity, I think you remember, they were chair people of our reopen committee. And it seemed a little odd at the time, back in April, that things were flaring up, things were severe. We hadn't, nothing was open at that point. We were thinking about what we were going to do once we could start bending the curve. And it was Albert and Inger that took the lead with the best scientific minds and the best business folks we could find, small business, all representatives at the table. And they did an amazing job, I think. We started reopening on May 20th, and our infection rate went down over the course of the next 4 or 5 months, which I think suggested that our reopening team played it right in terms of the balance of public health and getting our folks back to work and back to work safely. And having labor and business at the table is really important because business wants to open and labor was there to say, hey, we got to make sure that we're doing this safely. And they're armed with the scientific community as well. I think we gave people confidence that you could go back safely. And it's worked. We had a flare-up, as you know, in and around Thanksgiving. But right now we'll see if this is mitigated, only with increased continuing caution. And as I mentioned, the Vaccination Advisory Board, that's Deirdre, that's Reggie Eady. Deirdre, our amazing Commissioner of Public Health, Acting Commissioner of Public Health. She's Commissioner of Department of Social Services. Maybe she could be Acting Commissioner of Education. She's doing a lot. Reg Eady from Trinity Healthcare. And we got the best folks we could from the community as well as the scientific community to be able to tell people when the vaccine is ready, it's safe to do it, and how we can get that administered to you and make sure that any vaccine hesitancy we've tried to address as best we can. And that's where Marcella Nunez-Smith was so helpful. Marcella was helpful for us in our reopening committee, helpful for us in our vaccine advisory, doing the outreach, taking the lead as a leading doctor and scientist from Yale Medical School, and convincing particularly underserved communities that we want to take care of you, and the vaccine is the way to keep you safe and your family safe and your community safe. And she did great work for the state of Connecticut, and President-elect Joe Biden recognized that. And Marcella is now co-chairperson of the vaccine advisory team that President-elect Biden has put together. Another person who was recognized for his amazing work on behalf of kids, on behalf of students, is our outgoing Commissioner of Education, Miguel Cordona. And Miguel and I broke our heart as the schools were closing back in the spring, given the raging pandemic. And we started working together with teachers, working together with parents, working together with educators, doing everything we could to get our schools reopened safely, leading with public health. And for those that didn't feel like they could get back to school safely, they had a pre-existing condition, wanted to learn or teach remotely. Miguel helped take the lead in getting tens of thousands of laptops and Wi-Fi hotspots to those folks so they could continue to learn remotely. And I was particularly proud when President-elect Biden said, given the amazing work that Miguel Cordona has done on behalf of the kids in Connecticut, make him Secretary of Education. He can do that for kids all across the country. The Washington Post just said it was one of President-elect Biden's most inspired choices. And he's on the road, Miguel Cordona, but he's here to join us just for a couple of minutes here with his kids. Miguel?
Thank you, Governor. I hope you could see me. As you said, I'm on the road now, and just honored to be a part of this team. You know, I want to thank you for your support personally, and the whole team that's here. I see Paul, Josh, and Deirdre. Just amazing work you've all done, and I'm honored to serve in Connecticut, and I'm honored to be President-elect Biden and Vice President-elect Harris's nominee for Secretary of Education. I think it has a lot to do with the experience in Connecticut and the great work that's happening in Connecticut at the agency, but most importantly through the educators and the leaders in our districts who really worked hard over these last 9 months to make sure we do what's right for kids in a manner that's safe. And that starts with leadership at the top. So thank you, Governor.
Well, thank you, Miguel. And look, we were a little bit on our own when it came to schools back in March, April, May, and reopening. Not quite as much guidance as maybe we needed from the feds. With you there, Secretary of Education, as we go through this next stage and as we reopen our schools again, with the vaccinations coming through, I am so proud that you're there taking the lead on this. And we're going to miss you. Don't be a stranger. Definitely not.
Connecticut is always home. And, you know, it's because of my experience in Connecticut and my public education in Connecticut and my experience in the colleges, Connecticut colleges, that I'm even eligible for this. So thank you again for the support, for giving me a few moments to say thank you publicly. To the great people of Connecticut, thank you for all you're doing to support our educators. And know that the work is not done. We have a lot of work ahead of us. We're going to continue to do it together and keeping kids at the center of our conversations. So thank you. Have a great day, everyone.
See you, Miguel. Thanks. Over to you, Max.
NBC Connecticut.
Good afternoon. Governor, you alluded to all of those reports about the country being so far behind in the 20 million doses originally promised, but it sounds like what you're saying is Connecticut has not been impacted whatsoever. Can you confirm that's the case? And if so, why? How are we so insulated from the problem?
Maybe Deirdre or Josh wants to take that.
Yeah, you go, Josh.
I'll start because Deirdre is too modest, and she can pick up anything I leave off for. But a lot of it has to do with the preparation that the team in the Department of Public Health has put in over the last couple of months. Working with all of our providers, our hospitals, our local health departments, our federally qualified health centers, getting the plumbing in place, making sure people have the right training, understanding what's going to be coming so that when the vaccines have started to arrive, they can really hit the ground running. And so it's a tremendous team effort with our state teams here and our local provider communities. There's still a tremendous amount of work to be done, but we have seen the national statistics that show that we have gotten off to a fast start relative to the vast majority of states. It's going to get increasingly challenging as we go. As we get to phase 1B, the numbers continue to increase, but we're prepared to vaccinate as many people as we can based on the supply of vaccine that we receive from the federal government.
So will we see another ramp up then? Will that come with phase 1B?
Go ahead.
Yes, so we will be working to expand, and we're working now to expand the number of providers that will be able to give vaccinations. We'll be bringing retail pharmacies into the mix, more types of providers as we expand the eligible population for vaccines. And as the governor mentioned, we'll be sending recommendations to him next week on who's in the next phase. I did just want to add to Josh's comments about to say thank you to the team at DPH who have been working tirelessly to stand up this program. And I also want to acknowledge our community partners that were ready to receive the vaccine and got lots of people in very short order to get their vaccinations. Our hospital partners, our local health departments, our federally qualified health centers, our nursing homes who have worked really closely with CVS and Walgreens to get these clinics scheduled in rapid time. And we are really doing well in getting our nursing home residents and staff vaccinated. So really grateful to all of those partners who we know have been working tirelessly over these holidays because this is such an important program. And I want to just make sure and acknowledge and thank them.
And knowing that Connecticut is actually ahead of its neighboring states like New York in terms of vaccinations, what difference does it make if we're doing a good job when our neighbors are lagging behind? And how could that impact our efforts to open back up in the coming months?
Well, I'll start. You're right. We're part of this region, and I cheer on New York. They're going to get their vaccinations in place. They're going to, get that going. It's really important to our whole community. But right here in Connecticut, I'm just proud of the fact that, look, if we're going to have everybody in our nursing homes with their first vaccination, say by the end of next week, what that means in terms of hospital capacity right here at our local state level is really important. If we can get all those healthcare providers in the hospitals vaccinated, what that means in terms of having nurses and docs available to take care of folks that get sick right here in Connecticut is really important. So I cheer on my neighboring states every day, but what we're doing in Connecticut makes a difference as well.
And Governor, given that this is the last update of the year, would you like to reflect back on how far we've come in the last 9.5 months?
It wasn't what we signed up for. It wasn't what anybody signed up for. But I have just a renewed appreciation for. I wasn't quite sure what Department of Public Health did 2 years ago. Boy, we sure as heck know now. And I know what DSS does, and I know how all of our different groups interface. I know that these folks working on behalf of the state of Connecticut are working on behalf of you. I know that they could not take the time off. Every day they were doing what had to be done to take care of this pandemic. I realize the importance of the hospitals, especially the importance of the nurses every day showing up. A lot of people didn't feel confident about showing up, wanted to wait. And you can't do that if you're a nurse and people are sick. So these were my heroes. And that's my positive reflection of the last 9.5 months. And I'd like to emphasize the positive.
Thank you and Happy New Year.
You too, Kristen.
Channel 3 Eyewitness News.
Good afternoon, everyone. Governor Lamont, seeing that we're still in the thick of the pandemic, what are your expectations and hopes for this upcoming legislative session?
Yeah, we are. Paul is talking to the leaders, trying to put together a docket. First and foremost, we got to get a budget in place. It's going to be a little more complicated, no question about it. We'll see what the numbers look like over the course of January and February. See how confident the legislative leaders are about getting people back in. My probably recommendation is let's start doing more remotely. But that doesn't mean we don't have a lot of work we got to get done. And first and foremost, I think, is putting together a budget that takes into account public health, takes into account a little more certainty we have from the federal government. And that's really important to getting the public health right, making sure we have the resources necessary for the vaccinations and the testing, and the economy will soon to follow.
Thank you.
Fox 61.
Hi, Governor. This is Gabby Molina with Fox 61. Are you concerned about people having big New Year's parties at home this year since they can't go to bars like usual? And is there any planned heightened enforcement for restaurant and bars to make sure that they're not doing anything past that 10 p.m. deadline or closing time?
Yeah, to tell you the truth, Gabby, I can't sit around enforcing what happens in your private residence. We get complaints and we can show up, but the other 99% is related to what you can do. And keep to your closest cadre of friends. I know how aggravating this is to hear me say the same thing over and over again. I got kids, I hear it from them. In terms of those establishments, we're going to be strict. 10 o'clock is 10 o'clock. And fines will be exacted if you think you can skirt this just because it's New Year's Eve. You know, as I said before, we're doing pretty well in the numbers, and that's because we kept up our guard. This is no excuse to let our guard down now and go backwards.
And a question for Josh or Deirdre. Are you able to say at this point what's working here in Connecticut as far as vaccine distribution and what's not as we look forward to that next phase?
Want me to take it, Josh?
All right.
So a lot of things are working well. As I mentioned, our partners, our provider partners in the community have worked really hard to schedule lots of people to get their vaccines in very short order. And they're working 7 days a week. And so nobody wants to see a dose of this vaccine sit on the shelf too long or be wasted. So our partners are stepping up. As we mentioned, the CVS and Walgreens long-term care pharmacy partnership that was developed by CDC has been rolled out really smoothly in Connecticut. Very grateful to all the pharmacists who stepped up to participate in that program. And so we're continuing to work on acceptance. We're monitoring, how many people, healthcare workers, still are a little bit reluctant about the vaccine, and we're, communicating with them, make sure we understand what people's concerns are. And we're working to make sure that we can track all the data that we need on who's getting the vaccine as time goes by. So mostly positives on how the rollout is happening so far.
Hey, Deirdre, let me ask, things we don't control. Let's say the supply chain. There were some hiccups with Pfizer going back a couple of weeks. Do we have confidence that the supply chain is intact? And I hear that AstraZeneca has been approved, I think, in Britain. Could we potentially expand our vaccine pools soon?
Yes, to the latter question, Governor, the data is still not in, and the application hasn't been filed for that third vaccine here in the United States yet, but we do anticipate that will happen, and that we will have at least the opportunity for a third vaccine in the early spring of next year. So that's going to be a terrific help to our supply chain. And in terms of the logistics, I do commend the federal partners at Operation Warp Speed that have been managing the logistics and getting the vaccine here in Connecticut. They got here during the snowstorm with just a little bit of a delay, and that seems to be working smoothly. We have not seen interruptions or challenges with the delivery of the vaccine to Connecticut.
The one other thing I'll add is, you mentioned Pfizer, Governor. They've been fantastic, right? They've been delivering, they were the first vaccine out, right? They've been delivering everything that was promised. There was a little miscommunication through Operation Warp Speed team, but it was announced last week, too, that Pfizer is going to be doubling the amount of vaccine that they're going to be providing through Operation Warp Speed, and we're excited to see those numbers hopefully start to increase in terms of the allocations coming in Connecticut as well.
News 8.
Good afternoon, it's Jody Latina. Governor, it's a budget year. Do you think that you're going to be allowing taxpayers to delay the filing of their state taxes like we did last year?
I think it's something we're going to look at, Jody. I think it makes a certain amount of sense, but I think I should probably check in with Melissa first.
And do you have a New Year's resolution?
My resolution is let's get to 2021 as fast as we can.
Happy New Year. Thank you.
Thanks, Jody.
The Associated Press.
Thank you, Max. Good afternoon, everyone. I wondered if maybe Dr. Gifford or Josh could maybe talk a little bit more about what we can expect next week in terms of the recommendations for Phase 1B, because you had mentioned something about probably people over 75. I thought originally it was supposed to be over 65. So I don't know if you could talk a little bit about how much we'll learn. And also, Josh had mentioned on Monday that people will be able to log in and find clinics at some point. Will we learn more from this next week from the advisory committee on that as well, how that's going to progress?
So with respect to your first question, Our allocation subcommittee will be meeting next week, the subcommittee of the governor's vaccine advisory group, and they will be formulating their final recommendations for the 1B allocation to the governor and sending those to the governor shortly after they meet on Tuesday. So I would expect by Thursday that the governor will have received that recommendation. The CDC Advisory Committee on Immunization Practice, the ACIP, did recommend for Group 1B that it include frontline essential workers and individuals over the age of 75. That's the foundation on which the Advisory Committee Allocation Subcommittee is building. And so they may opt to make some additions to that group, but I don't want to speculate on what they're going to advise until after they've met. And with respect to, process for making appointments, that information will follow shortly after. That's not really in the wheelhouse of the allocation subcommittee, but DPH, working with our partners, will be getting out more information to individuals as to how they can schedule their appointment.
And do you have any idea of how many assisted living facilities will probably start vaccinations next week?
I do not have that number off the top of my head, no, but we can certainly provide that.
And Governor, the payroll deduction for Connecticut's new paid family and medical leave program, that begins on Friday. Republicans have questioned in the past whether or not the program will add up financially, but considering the large numbers of people who are unemployed because of the pandemic, does it make sense to you to still move forward with this? Will it generate enough money so there will be plenty of funds available for the benefits when they're supposed to be paid out in 2022?
Yeah, so I think we've learned over the course of the last 9.5 months of COVID that, certainly paid medical leave makes so much sense because otherwise people show up to work sick, and that's the last thing you want, especially in this time. We have to start collecting the revenues, as you point out on Friday, I guess it is, in anticipation of being able to roll out the program a year thereafter. And look, first of all, it's just worth remembering that if there's a great demand upon this and there's more demand than we had expected, that means the benefits go down a little bit, maybe not 12 weeks, but 11 or 10 weeks. It's not going to result in the delinquency of the fund. It's not going to result in any tax increases.
And I'll just add, this program was stood up in record time. We have the chairman of the Paid Family Medical Leave Board on the line here in terms of Josh Jabal, and of course the CEO of the program, Andrea Barton-Reeves, and her team stood this up quickly and efficiently, and for this to actually provide great benefits to the people of Connecticut at the time when they need it, when the program is fully operational. But as the governor stated, it's within the law as it deals with demand and the benefits and the premiums that's associated with it.
I just add, thanks, Paul, for that. I just add, in response to the COVID pandemic, the team did have the actuary that did the analysis behind the financial model, kind of rerun additional scenarios, looking at higher unemployment rates, higher need in terms of benefits. And all of the analysis so far continues to confirm that the solvency of the authority and its financial model should be sound, even despite the stresses that are being experienced across the state and the nation economically right now. So we're optimistic headed into the start of the program.
Thanks for that, Josh. And I just had one more quick question I forgot to ask Dr. Gifford. How long do you expect the free testing sites to remain open?
So we're going to need to continue to have a testing infrastructure in place for the foreseeable future until the majority of the population are vaccinated. So at least for the next quarter, we'll continue to have those sites in operation.
Okay, great. Thanks very much, everyone. Happy New Year.
You too, Sue.
Thanks.
CT News Junkie.
Thanks, Max. This question, I guess, is for Dr. Gifford or Josh, but the new strain or the strain of the virus that appeared in the UK seems to be sort of showing up in the US now. How are we prepared as a state for this new strain, and do we have the gene sequencing capacity to sort of detect it?
Pardon me. So how we're prepared is by doing the things that we've been doing all along. The way to manage the appearance of this new UK strain is by wearing a mask, avoiding gatherings with people outside of your household, keeping your physical distance from individuals when you are together. So it's the same strategies that we have been deploying all throughout the pandemic. That's what's going to be effective. And if we do find that this virus strain appears in Connecticut, which, as the governor mentioned earlier this week, we won't be surprised if we do find it here, because we know that now that it is in the United States. Then it's just a reminder to keep our guard up until such time as we are all fully vaccinated. There is no evidence at this point that our vaccines will be ineffective against this strain. And there's no evidence at this point that this strain makes people sicker or more likely to be hospitalized. That's the good news. The new strain is likely more contagious. So that means the mask is even more important.
Okay, thanks. Do we have the capacity to test for the gene sequencing? I understand the U.S. is sort of low as compared to other countries when it comes to that.
We are not doing the genomic sequencing at the public health laboratory. There are a couple of private labs in the state of Connecticut that are doing the genomic sequencing, and will be, if they find it, we'll be reporting those findings to the health department.
Yeah, I'd just add, under the leadership of Dr. Rizek at the state lab, as Commissioner mentioned, there is a coordination going on with all of our testing partners around the state. Many of the labs run an instrument that does pick up on a marker for this particular strain, and they're going to be reporting that if they come across it. They're looking for it. And then those that don't have been asked to provide positive samples to the state public health lab who do have that instrument, and we'll be looking for those. And then if samples are identified that meet that pattern, they will be sent to some of the local labs for genomic sequencing. Just shifting gears slightly, as many people may not know, Connecticut is actually one of the real pioneers of the high-speed genomic sequencing innovation that's occurred in the last 5 to 10 years. Dr. Jonathan Rothberg, some of his companies. So we're fortunate in Connecticut, Hugh, to your point, that we do have a tremendous amount of sequencing capacity here at Jackson Labs, at Semaphore, at other places. So we should be able to get quick insights if we do see the strain emerging in Connecticut.
Okay, thank you. One other thing I was wondering, what is our protocol in the state if refrigeration or power fails at one of these locations where we're keeping and cooling the vaccine?
So, as you know, the providers that receive vaccine are required to have data loggers, and that documents that the temperature has been in the appropriate range, so that if there is a power failure, we can ensure that the vaccine was stored at the appropriate temperature and is still safe to use. We also have a set of recommendations around backup power, relocating vaccine if there is an anticipated storm or power outage, and a number of other steps that we recommend to providers as part of their agreement for participating in the program.
Okay. Thanks, everybody, and Happy New Year.
Thanks, Hugh.
The Connecticut Mirror.
Hi. You mildly took issue with the president-elect, it sounded like. I'd ask you to be a little bit more direct. Joe Biden's comments were fairly alarming, saying it's going to be a question of years, not months, to administer the vaccine at the current pace. So what is your analysis of the basis for that statement? Is the president-elect wrong, or is he correct in reference to other places?
You want that, you guys?
Yeah, I think it's, there's a couple parts to that, Paz. at the end of the day, there's two parts of this, right? There's the vaccine that's being delivered to the states, and there's the states, administering, coordinating the administration of the vaccine. Connecticut, I think, as we've discussed, is doing, a solid job so far, certainly relative to others in terms of the second part of that, right? Once we have the vaccine, getting it administered. But I think the President-elect's point was, we will need more vaccine. We're already at the point where we have more administration capacity in Connecticut than vaccine coming into the state. So we need more coming in, and that can take the form of new vaccines that get approved, increased quantities of the approved vaccines. But we do need that to continue. Otherwise, we've been told at the current moment to expect about 50,000 doses a week. You do the math on that, and it will take far too long to get people vaccinated. But we are hopeful that we will see more vaccine coming in, and we'll be ready to get it out to folks quickly once it does.
So do you expect the 50,000 a week number to change? Because you're right. If you do the math, that's going to take it's going to take considerably longer than telling people in phase 2 to roll up their sleeves in June sometime.
We do. I mean, both in terms of, the news that was announced last week with Pfizer doubling their capacity. We see the progress of phase 3 clinical trials for the AstraZeneca vaccine, the Janssen vaccine, both of which seem to be hopefully getting close. So we can only forecast based on what we're told by the federal government, Operation Warp Speed, and that really only goes out a couple of weeks. So we don't have any firm guidance from them beyond that, but there's no question we will need those numbers to increase substantially to make the kind of progress that we'll be ready to make in Connecticut when the vaccine arrives.
So how much of a moving target is that at this point? I mean, I understand we all press you for projections and when people can expect it, but to what extent is this still a moving target as far as production levels and whatnot?
So it is. We are still getting information from CDC and our federal partners about when to expect, as Josh said, beyond the projected dosage levels. But there's every indication from both the additional vaccines that are promising for new approval and the increases in production that Pfizer has announced, production and distribution, that we anticipate we'll be seeing larger shipments of vaccine around the country. And I think we're just, wanting to make sure that the projected allocations are not put out so far into the future that they, inevitably need to be modified. So we're monitoring this week by week. But we fully anticipate, as Josh said, that there will be new increases in vaccine delivered as these other developments are final.
And Governor, what's your current thinking on when you would be vaccinated?
I think I'll wait for Deirdre's lead on that, but there's a group of essential workers after this first tier of public health care workers. That's got to be the number one priority. Then it's folks who have to get out every day to do work on behalf of people, and perhaps Deirdre would say I fall into that category.
What about state legislatures? I have not seen any discussion as far as where they may rank. Would they be just treated as the rest of us based on other criteria?
Yeah, I think that's still under discussion. I haven't talked to leadership. Maybe Paul has on that, Mark.
No, that's still under discussion. And as always, we're going to rely on the best recommendation put forth by the advisory committee as well as with the federal government. Sorry, DJ, a lot of pressure on you.
Thank you all.
Yep. I passed it to Paul, and Paul passed it to Deirdre. There's your answer, Paz.
The Hartford Current.
Hey, everybody. This is Emily Brindley from The Current. First question is actually just a quick clarification. Governor, in your vaccine update, when you said there's been nearly 55,000 doses administered, there's also a ranking there of the percent of doses administered by state. I just wanted to clarify, is that from the Bloomberg report? Because I believe that report only included 20 states. So Connecticut would be number 6 nationally, but actually out of 20, not out of all 50. Is that right?
You know that, Josh?
It is off that Bloomberg, although I think in that graph, I don't know how many were cited there. I don't know if it listed all the ones that they've included, because they did have a national average, so I assume they've got a full view of all the states. But yeah, we were relying on that graph from Bloomberg.
Okay, yeah, it looks like that report included 20 states, not all 50, but I can double check on that. Thank you, Josh. And then I also wanted to ask, I think this is probably a question for Dr. Gifford, about that more contagious strain that could already be in Connecticut or that likely will show up here soon. Because the strain is more contagious, when it arrives here, will you be expecting to see an increase of COVID cases because that strain is more contagious?
I don't think we know the answer to that for sure. It's certainly a possibility. And, it's a reminder to all of us that although the news is great on the vaccine front, and we're very encouraged by the launch of our program, we do have a few more months that we need to stick with the vigilance. So it is possible. The hypothesis is that one of the reasons they saw so much spread in certain parts of the UK was because of this variant. So it is possible that we would see more cases. It's also possible, if we keep doing what we're doing and continue with the vigilance and the care, that we wouldn't see a big uptick. But it's certainly a risk. I think people should assume now that we know that it's in the lower 48. I think we should assume that it's possibly circulating and act accordingly.
Thank you. And then just one last question. It looks like OPM has allocated about $15 million of the municipal COVID relief funds to expand testing for teachers and school staff. I was wondering if somebody could explain a bit about how that money will be used. And then kind of a related, if that set of Binax tests that were rolled out in Middletown, if those have been rolled out to any other school districts at this point.
I can start with that then, Josh. We're going to provide some priority testing for our teachers. So they'll be able to go and get tested, as needed at their discretion, so make that easier. And yes, superintendents have come to us, especially with the colleges not in session. A lot of that Binax testing, which gives you a real-time response, is available to our K through 12 as well. Anything else on that, Josh?
No, that's right. We'll be announcing shortly that some of that money is being used to stand up some new additional mass testing sites around the state, as well as to increase capacity at some others, so that teachers, child care workers, and others can have priority testing access to help ensure that they don't have to wait in long lines or can get tests quickly if they need to, outside of school hours. So that's what that money's being put to work for. We'll have more details on that announcement in the coming days.
All right. Thank you, everybody. Happy New Year.
You too, Emily.
Hearst, Connecticut Media.
Good afternoon, Governor. I think I was at that first crowded cheek-to-shoulder event in the Armory there, so it's been, yes, quite a year. I want to thank you on behalf of everybody for your candor most of the time, for your candor in this. This has been great, and Happy New Year, since this is the last Ned Variety Show of the year. I do want to ask about, just following up on Emily's question, I just checked, it looks like Bloomberg did update all the states in the last couple of hours, so we're still toward the top. I didn't count 6 or 8 or whatever the number, but it is updated, and we're toward the top. I want to get a little bit from Josh and or Deidre on the workflow in Connecticut for these vaccines, because I know there's been some sort of wringing of hands about that. I know, Josh, you talked about it yesterday. For example, how many of the 36,000, I think it's 3,600 pharmacists that are certified to give vaccines, how many are being called upon? How extensive is this? How long is a vaccine typically on the shelf in Connecticut once it crosses the borders? I'm just looking for a little bit more detail about the workflow for both the Moderna and the Pfizer vaccines.
Well, there are a number of questions in there. So how the vaccine arrives to the providers is it is shipped directly to them. They are they will be ordering directly eventually the number of doses that they can accommodate. And the vaccine will be shipped directly to the provider. So we are not acting as an intermediary. And they will only be shipped, providers will only be shipped the number of doses that they know that they can actually administer. So we're going to be working closely with them to match capacity with doses. So like I said, we don't waste any doses. In terms of the pharmacists, there was planned to be a large-scale commercial pharmacy part of this program. That's another federal partnership where commercial pharmacies that, for example, now administer flu vaccines would be brought into the COVID vaccine program. That's been moved up a little bit. So now those commercial pharmacies are going to be able to start helping us out in the next phase in 1B. They're not on board quite yet, but they will be important partners. They can't do as many vaccines in a day as some of our other partners who have the capacity to just vaccinate and have a high, what we call high throughput. But they will be, they're geographically distributed. People are familiar with them, so they will be a key part of our vaccine process in the next phase. Right now, the pharmacists are really focused on the long-term care pharmacy partnership. So they're out in our nursing homes vaccinating the staff and residents.
And there's some hesitancy on the part of some people. I understand the science, but the messenger RNA vaccines that are out now, some people are a little nervous about, perhaps without reason, when the AstraZeneca more conventional vaccine comes out, will people be able to choose and say, I want that one and not one of those?
Probably not. We're encouraging everyone to get vaccinated as soon as possible. And if these are all authorized vaccines by the FDA, we would encourage people to get the first vaccine that's available to them.
But people will certainly know. I'm sorry, go ahead.
And I did just want to emphasize the safety portion of your question and remind everyone that these vaccines have been rigorously tested and evaluated. CDC and public health departments around the country are continuing to monitor safety and effectiveness. And I think we can all feel confident in the safety of these vaccines.
But people will know what they're getting, right? You can ask,
Yes.
and you can see which exact one you're getting.
You will receive what's called a vaccine information sheet at the time that you receive your vaccine dose. It'll have all the details about the vaccine, and you'll be asked to sign that sheet, recording that you've been given the information about your vaccine. And you need to match your first and second dose and get the same type of vaccine each time.
Is there a maximum number of days under state policy or practice under which a vaccine sits in Connecticut before it's injected into an arm?
Well, that depends on the vaccine and the shelf life. But in terms of the COVID vaccine, as I mentioned, we're working very hard to make sure that vaccines arrive in the state and get into arms, as they say, as soon as possible.
But there's no set number of days. Like, it must be within 6 days or 5 days or...
No, as soon as possible.
Lastly, just looking at the 1B, I know there's some pressure to include 65 to 75-year-old people in ahead of frontline essential workers, and I know you've discussed that. I'm just looking for, perhaps from Josh, a little bit more definition of, or Dr. Gifford, what exactly is a frontline essential worker? Does that mean necessarily with contact with the public, or does it mean tradespeople who go to houses to repair things? What is a frontline essential worker, and how many are there, and how many will that be before we get to the Governor Ned Lamont age group?
Thanks.
Want me to take that, Josh? So, as you say, a frontline essential worker is somebody who is working directly with the public. So think grocery store workers, think rapid transit workers, think about other individuals who are dealing with the public and meet that definition of an essential workforce. There is a list that was provided by the CDC, and our allocation subcommittee will be reviewing that list. It's based on, a federal designation of an essential workforce. So they've divided that at the CDC into those that are public facing and those who are working behind the scenes. and they've recommended that we phase them. The essential workers that are public facing because they're at higher risk of exposure would go first, and then the essential workers without public facing duties would go second.
Thank you, and Happy New Year to everyone.
Hey, Dan, I got to tell you, I know you're fishing, but Hearst columnists are not essential workers. You can telecommute. You'll be after me.
You know, I was going to ask that, but I'm not that many years behind you, so we're gaining.
Speaking of that, I guess I'm getting the signal from Max. Hey, look, Dan was, kidding me about that first day in Danbury, March 6th, the first infection. We were all there cheek and jowl, and he just reminded me how much we have learned over the last 9 months. I mean, it was right after that day that we had the Surgeon General of the United States come up to Connecticut. That was a really important day. And I remember his message was, don't wear a mask. You'll pull it and it'll infect, and you pick up the germ much more likely tactilely than you do by air. He had us washing our hands and singing happy birthday. We've learned a lot since those days. Some have learned faster than others. I'm really proud of Connecticut. We've learned fast. We also know that not only does the mask make all the difference in the world, we also are warned about informal social interactions is the euphemism for it. Well, I think New Year's Eve is by definition an informal social interaction. I don't want to be a killjoy, but next New Year's Eve could be a really big show if we're really cautious this time around, and there I really urge you to err on the side of caution just a little bit longer. What a difference that could make. And Max, we have one of our friends, an oldie but goodie, about the importance of wearing the mask. With that, I'll leave you.
People ask me all the time, Gino, do I have to wear a mask? Yeah, you got to wear a mask. I mean, they say defense wins championships, but it's more than that. It's about being together. It's about being unselfish. It's about being a great teammate. So do the right thing, and you might get 11 national championships. You probably won't, but wear a mask.
UConn women are undefeated, and they deserve it. Wear a mask. Take care, everybody.